According to the Centers for Disease Control and Prevention, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community.
Mental illness, on the other hand, is defined as collectively all diagnosable mental disorders or health conditions that are characterized by alterations in thinking, mood, or behavior, or some combination thereof, associated with distress and/or impaired functioning.
Mental illness can affect persons of any age, race, or gender. Oftentimes, the Asian American population can be seen as a model minority. However, mental health statistics suggest otherwise.
Did you know suicide is the 10th leading cause of death for Asian Americans?
Asian American women ages 15 to 24 and 65 and older have the highest suicide rates among women across all racial and ethnic groups.
In addition, Asian Americans are 3 times less likely to seek mental health services as compared to white Americans.
Looking at these statistics, it is important to raise awareness on what to look for if someone you know or care about is going through difficult times. Support systems like friends and family are usually the first to recognize when someone they love may have mental health needs. You can be the one that makes a difference.
Let's start by learning about ways to stay mentally healthy. A person's overall health includes their mental health. Mental health affects the way a person thinks, feels, and acts. A person can stay mentally healthy by getting professional help if needed, by seeking services and getting treatment, connecting with others by staying active in a person's community, staying positive by keeping an optimistic view on life, being physically active by exercising regularly, getting enough sleep by having a routine sleep schedule, developing coping skills by becoming an expert on mental illness, recognizing early symptoms, engaging in treatment, developing a plan, finding support, and avoiding alcohol and illegal substances.
These factors can help protect a person from developing mental illness. Mental illness is not the result of personal weakness, lack of character, or poor upbringing.
There are certain factors that may increase a person's risk of developing mental illness, and those include family history, such as having a biological relative with mental illness, life experiences, such as stress or a history of abuse, biological factors meaning a person's genetic makeup, traumatic brain injury resulting from serious injury to a person's head, a mother's exposure to viruses or toxic chemicals while pregnant, use of illegal drugs or any substances that can alter a person's thinking or behavior, having a serious medical condition like cancer.
A person's risk of developing a mental illness may increase based on these factors. However, there are visible signs and symptoms of mental illness. These signs and symptoms include eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or feeling like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, constant yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, inability to perform daily tasks.
Experiencing one or more of these feelings or behaviors can be an early warning sign.
We've now learned the difference between mental health and mental illness, listed the protective and risk factors, and looked at some of the signs and symptoms of mental illness.
If you or someone you know is experiencing several of these symptoms that we discussed, or if any of the symptoms get worse, there are support services available.
The Montgomery County Department of Health and Human Services offers a variety of mental health, substance abuse, and crisis services.
For more information on these services, please contact Access to Behavioral Health at 240-777-1770.
Be the one that makes a difference.